a quick note whether the audio visual is all good. All right, so welcome to the today's session where we are going to discuss a very important topic in physiology, that is the oxygen hemoglobin dissociation curve. Okay, oxygen hemoglobin dissociation curve. So this is a topic that was suggested by many of you to be taken up in the upcoming NF100 episodes. So oxygen hemoglobin dissociation curve, we'll try to decode that topic, and we will have few MCQs, some very interesting conceptual MCQs also that we would be practicing at the end. All right. For everybody who's not aware of this, I would like to tell you about the crash course on mnemonics that I have started. 20th of April is when we have started that. You have the next session in the mnemonics crash course. We are planning to do it like a bit of subject-wise consolidated revision of the mnemonics. So 20th April we started. The next one is today, that is 23rd at 10:30 p.m. and it's a free live class today, right? We'll be starting with the plus course as well, a dedicated plus course for mnemonics crash course from 2nd of May till 13th or 15th of May is when we will have the plus classes dedicated for mnemonics. So we will have rapid revision of all mnemonics that we have been discussing, and there would be new topics discussion as well that would be exclusive on the plus. So the next mnemonics crash course session is basically today 10:30 p.m. Then on 25th and 27th 4 p.m. and 12 p.m. When are we meeting next today? Basically, the next session today is at 4 p.m. and it's a YouTube live session again where we will be discussing the most expected MCQs for FMG and also for NEET PG. It will be mixed bag MCQs, some one-liners, some clinical MCQs, image-based MCQs. So most expected MCQs for FMG is what we would be having at 4 p.m. today, and the next would be at 10:30 p.m. and this would be on the app, the mnemonics crash course. The plan for today in the mnemonics crash course is to include some mnemonics, discuss mnemonics from microbiology. Okay, we'll have microbiology in the today's mnemonics crash course. This is the calendar of the free test that we have, and the next All India mock test is coming up on 1st of May, right? The 1st of May is the next mock test that we have. You have Unacademy Lite, which is test series only subscription. We have the MBBS Prof 1 subscription that we have started for the students who have entered into first MBBS to help them with the university exams, to help them with the next preparation. Everything would be included with the MBBS Prof 1. We also have previous year question bank that has been updated. The last 4 years papers of FMG, NEET PG, INICT has been updated on the app. All right. And the new batch for FMG students is starting on April 27, the FMG revision batch. All right. And these are the subscriptions that we have. Links of NF100 after episode 54, all right, shall be updated in the Telegram group. All right. So this is episode 60 that we have. Now let's start with the discussion of the topic. Very important. Just give me a minute. Okay. First, an assessment question. Tell me, what do you think would be the answer to this question? All of the following except are the features of exercise. All of the following are features of exercise except which of the following? What do you think would be the answer to this? Absolutely right. It is, even if you have not read the dissociation curve, the rest of the options are very logical. That when we do exercise, the blood supply to the muscles increases because muscles are working more blood supply. Muscles need more oxygen, so there is increased oxygen extraction. What is pumping the blood? It is the heart, so the stroke volume also increases. So even by ruling out, we know that it's not going to be the left shift, it's going to be the right shift of the dissociation curve, because right shift releases the oxygen from the hemoglobin. So we are going to talk about this topic, oxygen hemoglobin dissociation curve. Okay, oxygen hemoglobin dissociation curve. What is the shape of the oxygen hemoglobin dissociation curve? What shape does it have? It is sigmoidal shape. It is sigmoidal shape. Why does it have a sigmoidal shape? You can see that it is like sigmoid like this, right? You can see that it's sigmoid like this. Why does it have a sigmoid shape? Basically because of the positive cooperativity, right? It is positive cooperativity. What does that mean? That one hemoglobin which binds to how many oxygen molecules? One hemoglobin binds to how many oxygen molecules? You have 4 oxygen molecules. Okay, so 4 oxygen molecules. If I ask you, the hemoglobin affinity for oxygen is maximum for which oxygen molecule? Is it the first, second, third, or fourth? Hemoglobin affinity is maximum, or hemoglobin binding is maximum for first, second, or fourth. It is the 4th oxygen, because binding of the first facilitates the second, that facilitates the third, and that facilitates the fourth. So it is the maximum for the fourth, right? It's a maximum for the fourth. So what do we see in the curve is that this is slow rising, and then it becomes your steep, and then you have the plateau which comes. Okay, then you have the plateau which comes. So hemoglobin binding is like our studies, or it's like any task in life that we want to do. It is the starting which is difficult, but once you start something, the momentum creeps in, right? The momentum sets in, and then it becomes easy. So remember that it's only the beginning which is the difficult. So you can correlate your oxygen binding to hemoglobin to your life as well. It's only the beginning. So if you're finding it difficult to study, at least start. Tell that I'll read for 5 minutes, and then you'll see that it's not difficult to stretch it to 45 minutes also. Okay. Video quality, let me see. Is there a problem today with the video quality as well? No, you can change it. Go to the advanced options and you can change the quality. The settings might be different in your phone. Right. Okay. So that was about this. The beginning is the difficult, then it becomes easy. So the 4th is the one which is the easiest to bind. Okay. And this part of the curve, okay, this part of the curve, what do you think? Is it the loading part or is it the unloading part? The loading of the oxygen or the unloading of the oxygen? If I ask you what is true in the oxygen hemoglobin dissociation curve, the plateau represents the loading or the plateau represents the unloading? Unloading? Think logically. What does oxygen hemoglobin dissociation curve represent? The relation of PO2 to the hemoglobin saturation, right? PO2, what do we mean by PO2 in simple terms? What is the PO2? PO2 means the dissolved oxygen. Okay, it's the oxygen dissolved in the blood. Saturation is the oxygen bound to the hemoglobin. Okay, the oxygen bound to the hemoglobin. When does the hemoglobin loading occurs with oxygen? When does the hemoglobin loading to the oxygen occurs? Does it occur in the lungs or does it occur in the tissues? Where does the loading occurs? Lungs or the tissues? Hemoglobin taking up the oxygen basically from the lungs, right? It is from the lungs we take oxygen, then it goes to the blood. So tell me, how is the PO2 in the lungs? Basically, it is the maximum oxygen which is there. The PO2 there is maximum. So it is a maximum PO2, right? So the higher the PO2, that means it is your lungs wala part. So this will represent your loading of the hemoglobin with the oxygen. Okay, this will represent the loading. And this represents the unloading. Is this concept clear? So at the high PO2, like let's say when the PO2 is 100, right? When the PO2 is 75, that is the loading, right? When the PO2 is high, that is your lungs where the hemoglobin is taking up the oxygen. Now, what does that represent? The plateau part represents that, like let's say till here, like you are reaching at 60, from 60 to 100, it's relatively flat. Is this good or is this bad for us? This is a good effect. What does that mean? That even if the PO2 of the blood decreases from 100 to 60, the loading of the hemoglobin, the oxygen loading will not be affected. So that's the reason that we can climb to high altitudes, right? Not very high, but at least some high altitude without affecting the oxygenation, without leading to hypoxia. But when that height crosses, when the PO2 decreases less than 60, then this loading will be decreased, right? Then this loading will be decreased. Okay. So remember that this is the good part. From 60 to 100, the oxygen loading of the hemoglobin is not affected. So we can climb to high altitudes. When the altitude increases more, that is the time when the changes occur and you would see the loading becoming less, tissues taking up more oxygen, all of that we would be seeing. Okay. So this is about this oxygen hemoglobin dissociation curve. Remember, it's a PO2 at the x-axis, saturation at the y-axis. What is P50? What is P50? P50 means the partial pressure of oxygen at which the saturation is 50%. Okay, at which the saturation is 50%. It is not the other way around. The saturation at which the PO2 is 50. That is not your P50. P50 is the partial pressure at which the SO2, the saturation, the hemoglobin saturation is 50%. This is the hemoglobin saturation. How much is the P50 generally? Around 25. That is 25 to 26 millimeters of mercury is when we have 50% of oxygen which is saturated with 50% of hemoglobin which is saturated with oxygen. Okay. Now going to this one, what causes the shift to the right and what causes the shift to the left? What do we mean by shift to the right and shift to the left? What causes the shift to the right and what causes the shift to the left and what are its meanings? Okay, what are its meaning? See, if the oxygen hemoglobin dissociation curve is shifting to the right, okay, if it is shifting to the right, that means what is happening? The easy trick to remember is right releases the oxygen. It repels or releases the oxygen. R for R. L means it loves the oxygen. Okay, it means it loves the oxygen. So can you tell me what is the change in the P50? If the hemoglobin dissociation curve is shifting to the right, is there a change in the P50 or the P50 is not affected? Is there a change in the P50? Yes or no? Right. So see, when this is the normal one, it is shifting to the right. This is your 50, P50. So for the normal, the P50 is somewhere here. For shift to the right, it is here. For shift to the left, it is here. So basically the right and the left, which is basically your x-axis, P50 to the right is increasing. P50 shift to the left, the P50 is decreasing, right? The P50 is decreasing. So P50 increasing, that means hemoglobin is not binding to oxygen very fast. The affinity, okay, the affinity of hemoglobin for oxygen, is it less or is it more? It is releasing the oxygen. It does not want oxygen. So the affinity basically here is decreasing. Okay. Now what causes the shift to the right and what causes the shift to the left? You can remember it conceptually also. Right. Shift to the right. That means releases the oxygen. When does that happen? When we are exercising, right? We want more oxygen to the muscles. So that will cause the shift to the right. Okay, that will cause the shift to the right. So what are the changes in the exercise in the muscles? What happens to the temperature? When we are exercising, right? We feel the heat, the temperature increases. So that is causing the shift to the right. What happens to the pH? When we are exercising, there is lactic acid which is produced. Acid means the pH is decreased. So acidosis will cause the shift to the right, right? There is also increased PCO2, the increased metabolism, increasing the CO2 production. So increased PCO2. what is happening? The 2,3-DPG is also increasing. Okay, the 2,3-DPG, which is formed in your glycolysis, even that is increasing. So basically, increase in everything, temperature, PCO2, 2,3-BPG causes the shift to the right. Remember, except the decrease in pH. It's your increase in H plus, that is decrease in pH, which causes the shift to the right. Absolutely right. That's your Bohr's effect. Right. That's your Bohr's effect. What is the Bohr's effect related to? The change in what leads to the oxygen release to the tissues. The Bohr effect occurs in the tissues. Okay. The Bohr effect occurs in the tissues. So basically what happens is, remember it as BH is basically your pH. So the decrease in pH basically leading to the release of oxygen, and this decrease in pH is also basically your PCO2, right? It's your pH or PCO2 which is causing the release of the oxygen. All right. Remember, increase in everything, temperature, PCO2, 2,3-BPG, except your pH, it causes the shift to the right. Okay, it causes the shift to the right. So going back to this graph, increase PCO2, increase temperature, increase 2,3-DPG, and you have decrease in pH, that is acidosis, which causes the shift to the right. Opposite is for the left, decrease PCO2, decrease temperature, decrease 2,3-BPG. Increase in pH causes the shift to the left. How about hemoglobin F? How about hemoglobin F? Shift to the right or shift to the left? So hemoglobin F, it causes the shift to the left, right? It causes the shift to the left. Why does it cause the shift to the left? Shift to the left basically means it loves the oxygen, right? It loves the oxygen. So hemoglobin F, for remember, it is friends with oxygen. It is friends with oxygen. It does not want to leave the oxygen, right? It does not want to leave the oxygen. So hemoglobin F is your shift to the left. Why is it left? Because it has decreased 2,3-BPG binding. Okay, the 2,3-BPG is less in your hemoglobin F. Why? Why the 2,3-BPG binding is less in hemoglobin F? Because hemoglobin F is alpha 2, gamma 2, right? The hemoglobin F is alpha 2, gamma 2. The adult hemoglobin is alpha 2, beta 2. So when you have this alpha and beta, the 2,3-BPG can bind to hemoglobin easily. That structure, that space which it needs is, well facilitated for 2,3-BPG binding. But here, it is not well. Absolutely right, Ipsita. So you have those, the amino acid replacement causing the change in the net change charge of the hemoglobin. That changes your 2,3-BPG binding. And tell me, normally 2,3-BPG binds to oxyhemoglobin or to deoxyhemoglobin? What does 2,3-BPG bind to? Oxyhemoglobin or deoxyhemoglobin? It is deoxyhemoglobin, right? It binds to deoxyhemoglobin, not to your oxyhemoglobin. Remember, it's your deoxyhemoglobin. All right. Now going to the next one, if you get a graph like this, or you can get multiple graphs like the image which is showing this is normal oxygen hemoglobin dissociation curve, and you'll be given the rest of the graphs like this, and you'll be asked identify which of these represents carbon monoxide poisoning. Is it A? Is it B? Is it C? Is it D? So these type of questions are very well asked. So yes. Carbon monoxide poisoning, what does it do to the oxygen binding? See, when there is hemoglobin and you have carbon monoxide which binds, how is the affinity of carbon monoxide for hemoglobin as compared to your oxygen? Is it less or is it more? Affinity of carbon monoxide for hemoglobin, it is much more as compared to oxygen. So what does it do? It replaces the oxygen and it comes and it binds to the hemoglobin. Apart from that, the hemoglobin which is already bound, it does not allow the leaving of that, the repelling, the release of that oxygen. So it decreases the release of the oxygen as well. So basically, whatever is bound, it keeps it bound. It is loved there. It loves the oxygen. So that is why it is causing the shift to the left, right? It is causing the shift to the left. What else is it doing is, because now carbon monoxide binding, it does not allow the oxygen to bind. The hemoglobin saturation, what happens to the hemoglobin saturation? The hemoglobin saturation falls, right? Because now oxygen cannot bind to hemoglobin. So what will happen? The curve will come down because saturation is on the y-axis in your dissociation curve. So the curve, the saturation will come down. So basically, this causes the shift downwards and leftwards. That is what we are seeing. You can see that it is shift to the left because now it is occupying the space. Oxygen cannot come. And the next one, okay, the oxygen cannot leave. And the next one is your downwards because the oxygen cannot bind. Okay. So remember that it affects your release also, and it does not allow the new oxygen to bind as well. So that is why the curve is shifting to the left and the curve is shifting downwards. Very, very important. This is your carbon monoxide poisoning. Can you tell me how will be the curve in anemia? How would be the hemoglobin oxygen dissociation curve in anemia? Anemia will be shift to the left and down, left and up, right and down, right and up. Where will the curve shift? Right and up. See, the up and down basically suggests your oxygen saturation. In anemia, will the oxygen saturation increase? Anemia itself means that hemoglobin oxygen saturation is less, right? So think logically. Up कैसे जाएगा? Oxygen saturation बढ़ना थोड़ी वाला है anemia में. It's gonna be less. Why will it will be down? Next, why will it be right? Because anemia, there is already less oxygen. So the release is increased, the tissues extract more. So it's right and down. Okay, it's right and down. So look at this graph here. Okay, if this is the normal one, okay, this is the normal one that we are seeing. This one is your graph which is to the left and downwards. This is your carboxyhemoglobin, that is carbon monoxide. And anemia is only to the right. It's not going to the left because the affinity is not increasing. Okay. So anemia is shift to the right and downwards, right? Carbon monoxide is leftwards and downwards. Please remember this very, very important concept. Anemia is right and down and carbon monoxide is left and down. Okay, it is left and down. Clear with everyone? Okay, look at this as well. So this is, if this is the normal graph, okay, this is the normal graph. All these graphs which you see, okay, the red, blue and the brown color, they are towards the left. That means they are carbon monoxide, left and down. Now, as the content of carboxyhemoglobin increases 20%, 40%, 60%, you can see the graph is going more down. Because logically thinking, jitna zyada carboxyhemoglobin, utna kam will be the oxygen saturation of hemoglobin, right? So increased carbon monoxide means the curve is more down, right? The oxygen saturation is decreased more. And you can see anemia, which is only shift to the right and down. Okay, shift to right and down, that is anemia. Okay. And classically in carbon monoxide poisoning, what is the history that we get? The history that we get is, garage or closed space and there is fire or there is smoke and the person is in a closed space. That is what is carbon monoxide poisoning. Why anemia is down? See, what does up and down represent? What does up and down represent? It is your maximum, basically look at this maximum height. It is your maximum oxygen saturation. So in anemia, isn't the definition itself saying anemia is hemoglobin is less? So oxygen, the saturation, the oxygen content will be less. Okay. All right. Let's go to the next one now. How is the curve of myoglobin? Okay. How is the curve of myoglobin? How is the myoglobin curve, the oxygen hemoglobin dissociation curve for myoglobin? See, it is not sigmoidal shape. Remember, it's not sigmoidal shape. It is called as rectangular hyperbola. Okay, it is called as rectangular hyperbola. All right. So why does it not show the sigmoid? Because it does not have your positive cooperativity, right? There is no positive cooperativity. So in myoglobin, which basically serves as oxygen reserve, okay, which serves as oxygen reserve for the muscles. You can see that how is the graph of myoglobin? Is it towards the left, or is it as compared to hemoglobin? Is it towards more left, or is it towards more right? It is more leftwards. What does that indicate? That with the same oxygen, the hemoglobin saturation, myoglobin ka PO2 is less as compared to hemoglobin. That means it has more affinity for oxygen, right? It has more affinity for oxygen. So basically, it serves as a reserve. It keeps on holding. It keeps on holding the oxygen, right? That is what is myoglobin. It shows no Bohr effect, right? Myoglobin does not show Bohr effect. When the pH decreases or PCO2 increases, there's no oxygen release. All right. Next one. What is the difference between hypoxemia and hypoxia? See, hypoxemia is decrease in arterial PO2. Hypoxia means to the tissues, the oxygen delivery will be less. Please understand this terminology. What is hypoxemia and what is hypoxia? Hypoxemia is decrease in the arterial PO2 and hypoxia is oxygen delivery to tissues is less. Now, will hypoxemia cause hypoxia? Yes, because when in the arterial blood the PO2 is less, basically the total oxygen content is less, that will also lead to hypoxia. Okay, that will also lead to hypoxia. So what are the causes of hypoxemia? That is your decreased PO2 arterial, right? Your arterial PO2 is less. When will the arterial PO2 be less? When the oxygen that we are receiving from outside is less. So it could be high altitude, right? Hypoventilation. We are not taking oxygen from outside well. There is a diffusion defect. So there is this lung, alveoli ka membrane. The oxygen is here. It has to cross and go to the blood. So if there is fibrosis, interstitial lung disease, there is fibrosis. The diffusion is not happening, right? So in that case, the PO2 will decrease. There is your VQ defect, ventilation perfusion defect. The oxygen is coming, but there is no blood there. Right to left shunt, okay, the right deoxygenated to going to the left side, that will also cause hypoxemia. So basically, remember, hypoxemia is PaO2 decreased. The question is in which of the hypoxemia the AA gradient increases. AA means alveolar arterial gradient. Very, very important. Where will the gradient increase? So basically, when the problem is in your oxygen coming less from outside, ठीक है? So high altitude पे क्या होगा कि बाहर से ही oxygen is less, but the diffusion is not affected. So the gradient will not be affected, right? In hypoventilation, we are taking oxygen only less, but the diffusion is not affected. Where there is a problem basically in oxygen reaching to the blood from the alveoli, that is where your AA gradient will be increased. Okay, so remember your diffusion defect, fibrosis, VQ defect, right to left shunt, they will have increased AA gradient. Your hypoventilation and high altitude will not affect the AA gradient because the oxygen crossing is not affected from the alveoli to the blood. Okay, the oxygen crossing is not affected. All right. Okay, let's go to this one. What are the causes of hypoxia now? See, hypoxia is the oxygen delivery to the tissues. If the heart is not working well, that will lead to hypoxia. Hypoxemia, any cause of decreased PO2 will be your, affecting the saturation of hemoglobin. Anemia, hemoglobin concentration is less, so oxygen content of blood is less. Carbon monoxide poisoning, we said it is decreasing the oxygen content because hemoglobin is not allowed to bind to oxygen. Cyanide poisoning is your decreased oxygen utilization by tissues because basically it blocks your electron transport chain, cytochrome C oxidase. So histotoxic hypoxia, it's not allowing the tissues to utilize the oxygen. Histotoxic hypoxia. Carbon monoxide is more of anemic hypoxia, even though it inhibits your complex 4, but it is at very very high levels, like 1000 times the toxic levels is when we see that complex 4 inhibition. So the predominant is your anemic hypoxia, the hemoglobin wala component, right? Anemia is anemic hypoxia. Okay, so this is your hypoxia ke causes. Bohr's effect we have already seen. Now coming to some MCQs, tell me, what do you think will be the answer to this? False about the oxygen dissociation curve. Right. Increase in pH causes the shift to the right. Remember, shift to the right is all increase except your pH, right? Except your pH. It is decrease in pH which causes the shift to the right. Yes, it is sigmoid curve, positive cooperativity. Combination of first heme with oxygen increases affinity for second. Fall in temperature, it shifts to the left. Remember, left matlab all low. Left means low. Left means loves the oxygen. Okay, low and loves, that is what you need to remember. Next one, which of these is not a cause of leftward shift of oxygen hemoglobin dissociation curve? I'm sorry, this is not leftward, this is rightward. Okay, should be right. Which of the following is not a cause of rightward shift of oxygen hemoglobin dissociation curve? What do you think would be the answer to this? It's a rightward shift, not a cause of rightward shift. Right is all raising, raising, all increasing, except your pH, right? So increased hydrogen ions, do not get confused here. When I say increased hydrogen, that means what's happening to the pH? The pH is decreasing, right? So that will shift the curve to right. Increased temperature, increased BPG. It's not your decreased CO2, it is your increased CO2 which causes the shift to the right, right? So answer will be B. Next one. Increase in P50 in oxygenation curve is due to decrease in which of the following? It's an applied question basically of your oxygen hemoglobin dissociation curve. Increase in P50 in oxygenation curve is due to decrease in which of the following, right? So see, you have P50 or basically PO2 on the x-axis, SO2 on the y-axis. So the increase in P50 basically means the shift to the right, right? Increase in P50 is your indirect saying of shift to the right. Shift to the right is due to decrease in pH, right? It's your decrease in pH which causes the shift to the right directly. Oxygen also might be right, but the better answer here is pH. Okay, the better answer here is pH. Fetal hemoglobin has higher affinity for oxygen due to which of the following? See, higher affinity means the shift to the left, loves the oxygen. So basically this option is out. It's not the shift to the right. Okay. Reduced pH also will cause the shift to the right. Increased carbon dioxide, shift to the right. Right. Increased CO2, shift to the right. Shift to the left, it's your decreased 2,3-BPG. We already said that hemoglobin F, alpha 2, gamma 2, the structure is such that 2,3-BPG is not able to bind. So there is decreased 2,3-BPG. Alpha 2, beta 2, that forms the best structure for your 2,3-BPG binding. Okay, so it's your decreased 2,3-BPG. So what are the factors which affect your 2,3-BPG? Remember, what increases your 2,3-BPG is your hypoxia, anemia, exercise, hormones like thyroxine and all, and raise of body temperature. But you know what is a tricky thing that I found is acidosis decreases the 2,3-BPG. Okay, that's a tricky thing that you should remember here, that decrease in 2,3-BPG is with acidosis, not with alkalosis. Okay. Also remember that stored blood, the 2,3-BPG decreases. Therefore, the curve is going to shift to the left, right? So because the acid citrated buffer that is used, it inhibits glycolysis that leads to decreased 2,3-BPG. Okay. Next one. The right shift is associated with which of the following? Very, very interesting. Yes, Apsita, that's what we said in the beginning of the class. It's the same concept. That's what Batula I said. That is the tricky thing here. Because, you know, what I think the concept behind this is, see, when we are going to high altitude, what is the acid-base disorder that we face? High altitude, what is the acid-base disorder that we face? Will it be metabolic acidosis, metabolic alkalosis, respiratory acidosis, or respiratory alkalosis? It is respiratory alkalosis. Why? High altitude, less oxygen, we hyperventilate. Hyperventilate leads to increased CO2 washout. So that leads to decreased PCO2. We know respiratory is opposite, the pH increases. It's respiratory alkalosis. But at high altitude, you also see that the 2,3-BPG is increasing. Right, the 2,3-BPG is increasing. Respiratory alkalosis increasing the 2,3-BPG. I think this should more so apply to your respiratory acidosis or respiratory alkalosis. Okay, rather than the metabolic acidosis or metabolic alkalosis. All right. So the answer to this, like many of you said A and E, majority said A. See, the right shift, this is the graph. You have P50 or PO2 and SO2. This is the normal. The right shift, of course, is associated with the increased P50, right? It's your increased P50. Definitely, it's your increased P50. Is it increased affinity of hemoglobin for oxygen? No, it is decreased. Hemoglobin repels or releases the oxygen. Right shift is repels. So the affinity is decreased. Repelling means the unloading of oxygen to the tissues is increased, right? So your anemia, exercise, all of that. Increased oxygen carrying capacity, decreased oxygen carrying capacity. It in no way affects your oxygen carrying capacity of the hemoglobin. The hemoglobin oxygen dissociation curve, the shift to the right or the shift to the left, the oxygen carrying capacity of hemoglobin is not affected, right? That is not affected. Is that concept clear? उसमें कोई फर्क नहीं पड़ रहा है आपके राइट शिफ्ट में से hemoglobin की capacity is not going to change, right? It is the affinity basically which is changing. The capacity is the same. The capacity is not changing. Okay. Stored blood shifts to left. Yes, that's what we said. The curve will shift to the left. Why? Because there is decrease 2,3-BPG, right? The decrease 2,3-BPG, decrease low. So that is the shift to the left, right? The curve will shift to the left. All right, another very, very interesting question. I think, yes, this is the last question. Interesting question, very conceptual, integrating a lot of concepts. A 38-year-old man moves with her family from New York, which is basically at sea level, to 10,200 feet above sea level. So it's talking about high altitude. Which of the following will occur as a result of residing at the high altitude? Which of the following will occur? D, E, F, or you can choose multiple options as well if you want. Right, if you want, you can choose multiple options. Whatever is right, you think you can choose multiple. Okay, so now basically I laid a trap for you guys. It's only single option which is correct here, not the multiple options. It is basically D which is correct. So at high altitude, the curve shifts to the right. You can also remember right is raising. Raise the altitude also, raising the levels of 2-3 BPG, temperature, PCO2, and the altitude. It shifts the curve to the right. Hypoventilation is not seen at high altitude. Why? Because the atmospheric oxygen, the pressure is less. We try to hyperventilate, right? There is hyperventilation that we see. So this hyperventilation, we just now said, it will lead to respiratory alkalosis because CO2 washout is happening. It will not lead to acidosis, it would be alkalosis. Next, arterial PO2 greater than 100 millimeters of mercury. No, arterial PO2 depends on your alveolar PO2 as well, right? So it will be decreased. It will be decreased. Okay. Decreased 2-3 DPG concentration, it is increased because you have hypoxia happening that increases your 2-3 BPG. That's a shift to the right. So there is shift to the right. Is there pulmonary vasodilatation? Many of you wrote E as well. Is there pulmonary vasodilatation? Always remember this concept, very, very important. Hypoxia, the only circulation which undergoes a vasoconstriction is your pulmonary. Okay, the pulmonary vasoconstriction happens in response to hypoxia. Why? Because if there's hypoxia, you don't want unnecessary blood to go there where there is no oxygen in the alveoli, right? So always remember that pulmonary vasoconstriction, but rest of them undergo vasodilatation, the rest of the circulation. When there is pulmonary vasoconstriction, by the back pressure, it will be your right ventricle which undergoes hypertrophy, not the left ventricle, right? Pulmonary will affect when there's pulmonary hypertension. It is a right ventricular hypertrophy, right? It's a right ventricular hypertrophy, so not your left. So even this is wrong, this is wrong. It's respiratory alkalosis, increase to 3 BPG, arterial PO2 not more than 100, and it's hyperventilation. Okay? Is this clear with everyone? So very interesting question. A lot of concepts is what has been tested in this question. Relation between pH and 2-3 BPG. Let me go back here. Acidosis decreases the 2-3 BPG. That is what it is. I mean, this is a bit of contradictory thing that I found while I was studying this topic. The acidosis causes the shift to the right. 2-3 BPG causes the shift to the right. So basically, acidosis should increase the 2-3 BPG, but that is not how it is. It is acidosis decreases the 2-3 BPG. I think to remember it and to avoid the confusion, you can relate it to respiratory acidosis and respiratory alkalosis rather than metabolic wala. So when you go to high altitude, there is respiratory alkalosis. High altitude increases the 2-3 BPG also. So remember respiratory alkalosis increasing the 2-3 BPG. Okay. Pulmonary vasoconstriction, Ipsita, because at high altitude there is hypoxia. So there is pulmonary vasoconstriction. In response to hypoxia, it's only the pulmonary vessels which act different and they undergo constriction. When they undergo constriction, the pulmonary arterial, the pressure will increase. That will lead to back pressure on the right ventricle. There would be right ventricular hypertrophy. Okay, right ventricular hypertrophy. What about Haldane effect and Bohr's effect? What about Bohr's effect and Haldane's effect? See, if you remember where do these occur, you will automatically remember what do they relate to. Okay, what do they relate to? So hypoxia increases 2,3 BPG, not decreases. So Haldane effect occurs in the lungs and Bohr's effect occurs in the tissues. Remember Haldane, HAL, it occurs in the lungs. What happens in the lungs? The blood, the hemoglobin is taking oxygen from the blood, from the alveoli. So hemoglobin binds to oxygen. That means basically there is loading occurring. So what will that say? Now I want oxygen because from the lungs that has to carry oxygen to all the tissues. So that will decrease the affinity for carbon dioxide. So that is your Haldane effect. In the lungs, oxygen binding to hemoglobin decreases the affinity for carbon dioxide. Bohr's effect, BH is pH and this is the tissues with pH, right? When there is decrease in pH, which basically occurs with increase in PCO2 in the tissues, that will cause what? The release from the hemoglobin, the oxygen release, that is your shift to the right. So basically the hemoglobin affinity for oxygen decreases, right? Remember it simply. This is like a simple concept that you need to remember. So when the pH decreases, acidosis increase PCO2, that causes the shift to the right. That means hemoglobin affinity for oxygen is decreasing. Okay, that is your Bohr's effect. So Bohr's BH is pH tissues, unloading of the oxygen. So hemoglobin affinity decreasing because the pH is less. Haldane, oxygen loading of the blood of the hemoglobin. So oxygen affinity increases, carbon dioxide affinity decreases. Okay. ठीक है. Is this clear with everyone? Okay, so that was about this session. That is your hemoglobin, oxygen, hemoglobin dissociation curve. I hope this is clear with everyone. And one more point, I think one of you had asked that query that how anemia shifts the curve downwards. Remember, it's not about your oxygen hemoglobin dissociation curve, the downward shift with anemia. It's basically your oxygen content of the blood. Okay, this is a graph which is showing PO2 and not the oxygen saturation. This is the total oxygen content. Okay, so one point that I want to clarify here. In anemia, the hemoglobin quantity itself is less, but the saturation is not affected. Okay, the saturation of hemoglobin is not affected. जितना hemoglobin है, even if it is less, the saturation is normal. The binding capacity is normal, right? जितना है उतने के लिए it is perfect, right? So it's the total content of oxygen which gets affected. So this is the graph that we showed. This is the oxygen content. Okay, this is the oxygen content and this is the PO2. Okay, that's the PO2. And this one is your hemoglobin saturation. In your oxygen hemoglobin dissociation curve, this is saturation and this is a graph which shows the oxygen content. Okay, please remember that point. All right. So thank you so much everyone for joining for this session. When are we meeting next? 4 p.m. we will have another YouTube live session where we would be discussing the most expected MCQs, basically important for FMG also and NEET PG also. You know, the must know MCQs. We are going to start practice of MCQs for FMG students also. 10:30 p.m. we have the mnemonics crash course episode 3. In the last two, we have seen pharmacology, PYQs. Today, we will see microbiology, right? Some important mnemonics revision from microbiology at 10:30 p.m. This is on the app. This is a special class. The code to unlock the class is Dr. Nikita. And this is at 4 p.m. on the YouTube. Okay, so 4 p.m. and 10:30 p.m. All right. Thank you so much and goodbye. Take care and keep studying, keep revising, and keep winning.